Hey everybody, I hope you're doing well on this Tuesday evening. There's some major breaking news that I wanted to share with you. I didn't want to wait until I got home, so I just pulled over here on the street to talk with you about this. First of all, Monday, which was yesterday, was the deadliest day here in New York State. We had 731 deaths just on Monday alone. That's about 30 people an hour dying here in New York State. It is more important than ever for you to cover up when you're outside with whatever you can do, with whatever means necessary. In New Jersey, it was their deadliest day as well. They had 232 people in New Jersey on Monday who lost their lives. That's almost about 9 or 10 every hour. And then the really big news that just came out just a few minutes ago is the high risk that African Americans in our country are facing to the coronavirus. Now, they don't know why that is yet. There's a lot of speculation about it. We're definitely going to be talking about it and have more information about this for you on Hot 97 on Street Soldiers Saturday morning at 10 a.m. I'm trying to reach out to Dr. Manny right now to see if he can explain this and break this down for us, because we did have a little bit of discussion about it last weekend. So what we're finding out is that this is a national... There goes another one of these, another one of the ambulances. You can see the sound of the ambulances has been it's just been like the New York sound right now over this last 4 or 5 days. And big shout out to all the EMS workers, the paramedics, and of course the emergency 911 operators who are taking those calls. But back to the story about how the coronavirus is affecting the African American population. The stats preliminarily that are available now from the CDC, this is from the federal government, because they're just now starting to break down these coronavirus cases by gender, by ethnicity, by location. So just check this out nationally. So in Michigan, that's where we saw that case of Mr. Hargrove, the bus driver that people spitted on. He did a Facebook video, and then unfortunately he died very recently. Michigan, African American population is 14%. They are 41% of the coronavirus deaths. In Chicago, African Americans are 15%. They're 42% of the coronavirus deaths there. Louisiana, 32% of the population and 70% of the coronavirus deaths. So you can look at these numbers, and there's a lot of different things, obviously a lot of different factors that play into it that we certainly know about. There's systemic racism. We know there's been a lack of access to adequate, competent, continuing health care in the African American community as well as low income communities. So that may be a factor. And there's also the issue of, if you look at the people that are driving the buses right now, I'm pretty sure if I went to that BXMM one bus, chances are very good that the driver of that bus is African American. Many of our store workers, our store clerks, many of our emergency responders, they are African American, so they're on the front line. That may be one of the explanations. But one of the other explanations, which we're seeing in the Bronx too, is there were a couple of COVID-19 testing sites set up in the Bronx, but in reality, those sites, you had to have a car. There was no testing at Lincoln Hospital, which is a city hospital, which is accessible to everybody by subway. All of the buses, the 149th Street buses, the 3rd Avenue buses, all of those buses go right over there. Grand Concourse is close by. But people had to have a car in order to go to a drive-through testing spot in the Bronx. That's one of the reasons why it was difficult for people to get to these testing spots if they could get an appointment and to drive through. And then we're looking at the Bronx, and we're seeing at least double the number of coronavirus cases in the Bronx compared to the rest of Manhattan. So this whole issue of why are African Americans more at risk? Are there dietary factors? Are there factors based on racism? Undoubtedly. Are there factors that are based on historic inequities economically? Absolutely. Are there factors also based on where the hospitals have been, where access to healthcare has been, where these things are? I'm just going to stop for a moment and say a prayer for that person in that ambulance. I think they're going up to Allen Pavilion, further up Broadway here. Or maybe they're going to pick somebody up and take them down to Columbia Presbyterian. But anyway, pray for that person that's in there and for those paramedics who have to who are risking their lives bravely trying to save other people. But anyway, we don't know what the reason is for this inequity in these numbers. There's a lot of suspicions. There's a lot of reasons that we can imagine just based on what we already know in terms of healthcare in the African American community. And then the higher rates of these diseases that are now considered factors, such as diabetes, such as heart conditions, some of these things that are, what the doctors call, what Dr. Manny called on the show, these comorbidity factors, which are basically, if you have one of these chronic conditions or you have one of these diseases, if you have one of these diseases, you are basically at much higher risk for getting any other types of diseases, and your immune system is much lower. So those are the things that we're going to learn more about in the coming days, but this is really the first time in terms of the numbers nationally, or at least in some of these hotspots like Louisiana, like Detroit, like Chicago, where these kind of figures have been available. So it's the first time the federal government, the CDC, is actually taking a look at them. I wanted to let you know about that. It is so important for you to take these precautions, to take them seriously. Governor Cuomo says the minute people start to let go of their cabin fever and go out on the street and feel like they can do whatever they want to do and not take precautions and not practice social distancing, which I'm practicing now. As you can see, as I'm talking to you and doing this video for you, we're going to see the numbers. We're going to see the numbers start to go up, and we don't want that to happen. The other issue is, the access to testing in these other states. We've seen it here. That has been a problem absolutely everywhere, regardless of what race you are or ethnicity. But of course, as we have seen historically in America, that our African American population tends to be the ones that are getting the short end of the stick, whatever that stick happens to be. So I just wanted to give you that information. It's not good news. It's something to be very concerned about. But if anything, what we can do, what we all can do, is we can press and push our elected officials for health equity. We can push that funding for testing sites, neighborhood-based testing sites that people can get to, without having to own a car and drive there, that is available to all of our communities, especially our African American communities. And once again, to all of our frontline workers who are out there, whether you're working in a store, whether you're delivering packages, whether you're here at the grocery store, whether you're driving a bus, whether you're down below here, running a subway car or subway train so that other people can get to work. Big shout out to you. We love you. We support you. Our grocery store workers, our home health attendants, our professionals that are going into people's homes, helping them that are mentally disabled, physically disabled, our medical transport people who are transporting people to some of the essential therapies that they need and still have to get, regardless of what's going on with the larger scheme of things. A big shout out to you. Thoughts and prayers for you. And we really have to we have to get used to this. We're not out of the woods yet. We are really in the thick of it right now, and it is more important than ever that you practice social distancing, and more important than ever that you stay healthy. Dr. Manny was talking about, don't use this as like, oh, it's vacation, I can binge eat, I can drink. I know it's depressing. A lot of it is depressing or whatever, but thank God we have the internet and all. We have access to a lot of entertainment now that we never had, and this is the time when it really gets tough. We just saw a church today, St. John, the Cathedral of St. John the Divine on 112th Street by Mount Sinai on the Upper West Side. They are turning, this situation is so critical right now, they are turning that church into a pop-up hospital. This is Holy Week. This is one of the most important weeks for Christians, but the people at the Cathedral of St. John the Divine, a big shout out to you. They're turning the entire cathedral. This is the largest Gothic cathedral in the United States, a historic cathedral. It's the one where they bless the animals every year, and very progressive. They are donating their church space for tents inside. It's a huge church, so that they can build tents and build beds so that we have beds as we go into this crisis. Governor Cuomo says right now it's looking okay, not great. It's looking okay in terms of the ventilator situation. The hospital admissions were down today. have been down the last couple of days. Death rate is up, so that's what they're seeing happening. But again, there's a lot we don't know. We don't know about people that are dying in their apartments, that they haven't been able to collect the bodies or count all of those bodies. And I don't mean to be depressing, but this is depressing news, and you need to know what's really going on so that you can protect yourself and understand that this is serious. There's a lot of us, we can move around. I go to work. People are going into the fine fair right here. They're going into the grocery store. The check cashing place is still open. They're doing the things that they need to do. A lot of the stores are closed here, the barbershops, the nail salons, all of that, the dental places. But the most important thing is that you continue to practice the social distancing. Governor Cuomo says that's why it seems like things are starting to level off, is because we are, as a state, practicing social distancing. And I think it's very clear now, more than ever, that we need to do it. Governor Cuomo was real blunt about it. So has Mayor de Blasio has been real blunt about it. And that is that your failure to practice social distancing could cost another human being their life. Think about that. Your failure to follow the rules, these simple rules. Inconvenient? Yes. Does it stink? Yes. Is it awful? Yes. Is everyone tired of being at home all the time? Yes, yes, and yes. But failure to do so, hanging out, going out in crowds, that can cost somebody their life. So you have to ask yourself, is it worth it? And I would have to say, no, it's not. We all have to do our part. This is a war. We can win the war. We all need to be together, and we can win that war. And I just want to say something else too. If you need food, or if you have neighbors in your apartment building or in your neighborhood, if you're in a private home or multifamily home neighborhood, if they need food, every day outside the New York City public schools, they have set up what they call meal hubs. You can go and pick up for free, no questions asked, from 7:30 to 11:30. Parents with children can go to pick up the kids' meals and the adult meals. You have to have a child with you, to pick up for the children from 7:30 to 11:30, and then from 11:30 to 1:30. It's a pickup for adults. You can pick up a breakfast, a lunch, and a dinner, and a meal, and a grab-and-go type of meal. You can pick up more than one. You don't need an ID. You don't need to register. You don't have to have any kind of card or this or be a part of any pre-existing program. This is simply a humanitarian effort that the mayor undertook to make sure that no New Yorker goes hungry in this crisis. There's grocery stores in some of the neighborhoods that have shut down. There's other grocery stores where they don't have what people need. There are other places where people don't have the money, or where they can't get in, or the lines are too long, or whatever. So look up meal hubs. It's in one of the posts from today on my Instagram page. You can see the information is there, the website is there, and you really need to check that out. The other thing I wanted to talk about, I have them in the car, but I wish I had it right here to show you, is when you finish with your blue or whatever color they are, your latex gloves, don't throw them on the street, because you're not helping the situation. And when you take them off, you need to take them off very, very carefully, like peel them off like a banana, so that the outside of the glove is not touching that part of your hand that you had just protected. And then what I do when I get home, I still wash my hands with soap and water, and that's what you need to do in order to be safe. The other thing that developed today in New York City is the mayor is saying they're going to really start cracking down on people who are not practicing social distancing. There's going to be those fines. You're going to be getting those fines. It's not going to be a good time to be getting a fine. So pay attention to that. Let's win this war. We're all in this together, and keep you posted as I get more information. But please follow me on my Instagram page. Please tune in on Saturday, 10 a.m., Sunday, 7 a.m. We're going to have Dr. Manny with us back in the studio answering the medical questions. We're going to have Dr. Jeff Gardier, the famous psychologist. He's going to be with us for about half an hour each day, taking your calls too, about this whole mental health piece. So there's a lot to this, but it's like we can get through this. There's going to be light at the end of the tunnel. It's looking very bleak right now, but we have to do this. We have to buckle down, strap on, and really just deal with it, okay? So have a wonderful night, and leave me any questions or comments. I'll try to get you the answers, okay? All right, love you guys.